Hi, live, Facebook Live. Is this working? I don't know. This is being done from my computer here, and I'm using a microphone, and I don't know why I'm getting the feeling it's not working because it all looks a bit strange to me. I didn't think I could do it from my computer. I spent ages trying to do it from my computer when I first started, and I thought I had to do it from my phone. So I'm doing it from my computer here, and it says I'm live, so I hope I am live. So we'll just keep going and see what happens. So I hope the audio is working. Time will tell. Okay, so I had a couple of weeks off, just back from a holiday, 2-centre holiday, Guernsey and Wales. So that's obviously quite glamorous. So any aspiring plastic surgeons out there, that's what you can hope to achieve. Get the dizzy heights, Guernsey and Wales, 2-centre holiday. No, it was very nice. But it is really good to be back. And having a good week this week so far, early days. Did read something on the internet today about a before I talk about the questions, I have got some questions, but about someone who had some clinic which is in the news because of bad treatment, and someone's doing non-surgical treatments and they're not trained, and someone complained, and then lots of people started complaining because saying that they've had terrible outcomes, and people were saying it was not a nice place. It was very cold, and the practitioner wasn't very pleasant, and I couldn't help but think that I can understand why people go ahead with things, because it's quite a big deal to go to a cosmetic clinic and, you know, thinking of having something done. But I couldn't help but think that, you know, just go with your gut feeling, and if you don't feel comfortable at a place, then just walk away, just leave. If they're good practitioners, they'll be happy for you to come back another time. And I, you know, we do. There's a big thing about having a cooling off period for bigger procedures, but for smaller procedures, there isn't that necessity to have a cooling off period. And actually, a lot of people want to have the procedure done on the day of the consultation, and we do that here. We do a see and treat service, which is one of the sort of, not a unique selling point, but sort of like a good selling point, I guess, because a lot of the hospitals don't allow you to book the operating theatre at the time of your clinic because they need it for other people, whereas because we've got our own theatre here, we can operate on the same time as seeing people in the clinic. But at the same time, there's never any pressure to go ahead, and if you feel that you're not sure about things and you're not sure about having a scar or whatever it is, then just go, and you can always come back next week or the week after. And I think all these people coming out saying that this clinic wasn't very nice and it was cold and the practitioner wasn't nice, I feel like saying, well, you know, maybe you should have not had the procedure done and then said, I want to have a think about it. So I just thought about that there. So yeah, so we're on the new system here. We're on the computer doing this. I'm not sure where comments will be, if there are any comments. I'm hoping my audio is working, and I'm not. Anyway, I'm assuming the audio. I'll assume it's all working until I finish this and then realise that it wasn't. So we've got some questions here. Can you pierce your ear in the same spot after split earlobe repair? Great question. And obviously you can do anything you can if you want, but it's not. You shouldn't. When you have a split earlobe is when you have an earring in and it either pulls through or gradually elongates. And sometimes there's a tiny little bit of skin left behind, or it can just gradually elongate and pull straight through. And it's a relatively simple thing to repair, and there's two ways of repairing it. One is by stitching it up. It's not as straightforward as that. I've done a video on my website, I think, about the actual ins and outs of how you stitch it up, but basically bottom line is, you know, just close the gap. But if you do that, you shouldn't have the earring pierced at the same place, because that will be at the apex of the scar. And if you have your earring pierced in the same place, there'll be scar all the way below it. And so scar is always weaker than normal skin. So you shouldn't have it pierced there. because it's likely to pull through again. And this is often a problem for people who have one earlobe that's split and the other one's not, because when you first have your ears pierced, you have them pierced in the ideal spot of the lobe, in the center of the lobe. And so when you say to people, look, you've got to have it repaired, but then you have to have the earring re-pierced offset from the scar, they're like, well, then my earrings will look asymmetrical. It's, guess, not so much a problem if both are split, because then you can have both re-pierced in an asymmetrical place, but then you might say, well, actually, I quite like the hole being right in the center of the lobe. Therefore, there is a technique that you can use to repair the earlobe, keeping the hole. There is a way. It's a technique that I've published with Mr. Naranjan, who is a surgeon in Chelmsford that I used to work for many years ago, and he came up with the technique, and he's done some very nice drawings which are on my website, and I wrote it up with him. And basically what the technique involves is taking a piece of tissue from either side of the split and using that as a hammock to reinforce the repair, so you end up with the hole in the original place. It's a double flap technique. So there's two flaps of skin, and those two flaps of skin support that repair, so that's stronger than it would have been if you just closed it directly, but it's always going to be weaker than normal skin. So I always say, look, you can't wear big ding danglers, and there's always a potential for it to pull through again, but that is something that we do offer, the double flap technique repair, which does allow an earring to be worn in the same place as the original earring. So that's answered that one. If dissolvable sutures, this is a question asking if dissolvable sutures are used for mole removal, and whether, oh no, that's the next question. So good question. I don't know where that question is coming from, if dissolvable sutures are used for mole removal, because it depends on the surgeon. It depends. I don't use dissolvable sutures very often for mole removal. There's two places, I guess, you can use the stitches when you're closing a wound. If you have a deep wound, sometimes you'll use deep stitches, which are always dissolvable. Well, not always, but usually dissolvable, because they're deep inside the body, and so you don't want them to be there forever. You can use dissolvable sutures in that situation. And certainly if I was doing a mole removal on the trunk, and if it was a big one and the wound was under tension, it's often good to put a deep stitch in, or a couple of deep stitches in, to take the tension off before you put the skin sutures in. And the skin sutures are usually not dissolvable. Again, on the trunk, they often, so this is a big question that I should have thought this through. So, right, God, this is a big question, actually. Right, so on the trunk, I often do use dissolvable sutures in the skin. Right, let's go. Can we do this again? No, okay. So, question: are dissolvable sutures used for mole removal? Right, I'm going to break that up into face and body. Okay, so on the face, I very rarely use dissolvable sutures, but if their wound is under tension, then it can be useful to put maybe one or push two dissolvable sutures to bring the tension off the wound before you put the skin sutures in, and the skin sutures are usually non-dissolvable sutures on the face. The reason for this, you might say, well, I want dissolvable sutures because I don't want the hassle of having to come back and have the stitches taken out and all that sort of stuff, and I understand that. But a non-dissolvable suture you can take out at a much more predictable time. You can take out at 5 days, 7 days, whenever it is. You can say, look, I want to take that stitch out, and that stitch will be out at that time, because the worry about leaving stitches in too long is you get stitch marks. There's that classic look of a scar with a straight line with the dots on either side. That's because the sutures have been left in too long, and they've got they've actually left scars themselves. So on the face, you don't want stitch marks, so you want to take the stitches out at a certain time. Now, sometimes in very small children, who's going to be a real problem, you might need to give them a general anaesthetic to take the stitches out. You could use dissolvable sutures, which will then fall out, and there's special dissolvable sutures you can use, which are short lasting. There's a whole range of dissolvable sutures which take different lengths of time to dissolve. So on the face, rarely, usually it's a non-dissolvable suture because you'll want to get the best scar possible. On the trunk, on the body, on the arms, the legs, and the torso, you may well use dissolvable sutures. This is clear, isn't it? Dissolvable sutures to take the tension off, because it's under the wounds are more likely to be under tension on the trunk. And also, I'll use a dissolvable suture often in the skin on the trunk. The reason for this is the skin of the trunk takes longer to heal, so you want the stitches to be in for longer than the face. The face heals really well, so you can take the stitches out in 5 or 7 days, and you're going to be fine. On the torso, on the arms, the legs, and the back particularly, it takes longer to heal, and so you want the stitches to be in longer, so you would use a dissolvable suture, and sometimes you would bury that dissolvable suture underneath the skin. Sometimes you'd leave the stitches on the outside, but the main priority is to get the wound healed, and cosmetically the scar is often not quite as good on the body than it is on the face. And so you're more likely to use dissolvable sutures on the body than on the face. I wish I'd thought that through and answered that question better, and I'm sorry that I've rambled a bit, and that's the problem with Facebook Live. I can't do it again. I'd have done that again if I could have done, but anyway, I thought that was going to be an easy question, but I made it sound difficult. So yeah, answered, yeah, dissolvable sutures are sometimes used for mold removal. Yeah, sorry about that. I've got to get this one right now. Should you expect your breast implants to drop to lower than the crease of your breast? I know what this is about, because we've got a patient at the moment who's been in touch who said, look, they're worried. There's all sorts of things that can go wrong with breast implants. They can sit too high, too low, too far to the side, one up, one down. There's all sorts of things that can be bad about breast implants. But in my experience, by far the worst thing, no, not the worst thing, the most common problem with implants is that they sit too high, particularly when they're under the muscle, which is the patient who is asking this question. The main problem is they can sit too high. Now, they always sit a bit high to start off with, and then they settle. And the main problem with implants is that they can sit too high, and so that is the thing that I really worry about, implants sitting and being too high. So this patient has contacted us, I think she's quite shortly after surgery, saying she's worried because they're dropping, and they're worried they're all going to drop too low or whatever. I'm not really worried about them dropping too low, to be honest with you. In the early stages after surgery, I'm not really worried at all, because things take a while for them to settle. So exhibit A, number one, too high is usually the problem with implants. And when I'm talking to people with implants, I always say put them in low, because the worry is it's going to be too high, particularly under the muscle. Now, talking specifically about the breast crease, again, I think one of the problems with this day and age is I think a lot of patients get involved in a lot of patients get involved in the ins and outs of surgery, and they want to know all the sort of stuff about it. I wouldn't get too much involved in it, but in this case, and often in the case, particularly in patients whose breasts are sitting a bit low, they've got a bit of a droop to the breast, they've got what we call ptosis. These are difficult cases to use breast implants in, because if your breast is sitting low and you put implants in, if you put the crease, or the inframammary fold, or the crease where your bra sits, is like a set landmark on the breast. And if the crease stays where it is, and you've got a ptotic breast, so it's your breast that's sitting low, and you put the implant in and it's held at the crease, it will look weird. It will look elongated. You'll get a Snoopy deformity, or you'll get a funny looking breast. You'll get an implant that will be up here, a breast that sits low, and it will look weird and it won't look right. So in patients who've got ptotic, and also sometimes people who've got very small breasts, they're often a little bit deficient in the lower pole. And again, if you kept the fold where it is, it would look weird. The nipple has to be centered on the breast, and so it's often the case that we need to lower the fold. The fold needs to be lowered at the time of surgery in order to get the implants centered on the breast, centered on the nipple, and to make the breast look normal. And people think, oh, I'm worried because my implants are dropping and they're looking low. And this is the importance of the preoperative discussions, because you need to be aware that if your breast is sitting low pre-op and you don't have a lift, they'll still sit low post-op. They'll be bigger, they'll be enhanced, they'll be fuller, but they'll still sit low. But they'll have more volume, and you just have to be aware of the sort of shape that you can achieve when breasts are sitting low, because, and I think this is what should you expect the breast to drop lower than the crease of the breast. So the crease will be naturally lowered. That's normal. Now, the one thing about the implants dropping lower than the crease that's slightly worrying is what is something called a double bubble. A double bubble is when the implant actually descends lower than the breast crease, and you have a notable breast crease, then another bump below it. And that is something that can happen with implants, the so-called double bubble, bottoming out. And so that is a bit of a worry. If that happens, then something needs to be done for that. Again, if it's early stages, we need to see how it looks and how it, the bottom line is, does it look weird, I would say, or not? If it looks weird and doesn't look right, if there's a sort of a bump and then another bump, then that's not right, and that's something we might need to do something about. So that can happen. Bottoming out can happen with implants when they descend below the crease of the breast. But that's slightly different to having the crease lowered and having the implant sitting with the breast. And as I say, I wouldn't worry too much about the ins and outs of creases and bottoming out and double bubbles and Snoopy deformities. The bottom line is, does it look okay? If it looks okay, it's okay. If it doesn't look okay, it's not okay. It doesn't matter what you want to call it or what the reason for it not looking okay is. So I think you just got to be asking the question, does it look okay? And if it doesn't, then a good one, Amy. Question live. That's what I like to see. That is what I'm talking about. Live questions coming in as I speak. So that is the bottom line with any surgery, with any particularly cosmetic surgery. It's all relying on a good outcome is patient based. So if the patient's happy, then it's good. If the patient's not happy, it's bad. So, but yeah, I try and be clear with patients whose breasts are sitting a bit low about what sort of outcome they can achieve, because you need to be aware of, that's how you get a happy patient. You get an unhappy patient, so I say, yeah, we'll do breast implants and you'll look like this person who's got a totally different body shape to you. People come in with photos of people, totally different body shape. You're like, well, hold on a minute. That might not be achievable. So you have to be aware of what's achievable. So we've got a live question coming in by Amy. Amy's saying, it's a random one. When you do a breast augmentation, can you do a removal of a belly piercing scar that has stretched? Belly piercing? I've not heard of a belly piercing scar that's stretched before. Well, you can do anything you want, Amy. You can do loads of stuff when you do a breast augmentation. So yes, definitely you could. So I'm assuming, I guess, the piercing has been pulled, and so yes, you could just sort of excise the core of the piercing and close it up. It would leave a scar where the piercing was, but that'd be relatively simple to do. And definitely could be done at the same time as a breast augmentation. No problem at all. And you know what? I'm going to go so far as to like that comment, because that is what we want. Comments live. And yeah, I think I'm back from holiday, and I think I'll answer those questions pretty badly, I feel. I'm sorry about that. Sorry that I belly button stretching during pregnancy. We've got Amy coming back at me now with another thing. Can you do a belly button stretching or belly button piercing stretching? You mean an outie? Or, to be honest with you, you can do surgery to the belly button at the time of breast augmentation, whatever it is. Maybe talking would be easier than this format, but yes, Amy, you can do, yes, belly button stretching during pregnancy can be fixed, or if it's the E version of the belly button, or if it's a big piercing or stretching of the piercing. Anything is possible, I would imagine. Yes, you can do belly button stuff. Right, so that's good. So hoping this is, I wonder how this looks, if it looks better than the phone or worse than the phone. You'd think it would be better, wouldn't you, being a computer, but I don't know, not convinced myself, but we will see on the playback. I hope that's all. I'm just going to wait. Oh, right. I'm just, well, I'm not going to wait, actually. I will wait if anyone's going to say anything. Not that I won't. I'm happy to wait if needs be, but in the absence of further comments, I'm going to check myself out of here and head for the hills. Taxi's waiting, so hope that was helpful, and please do keep asking questions, and maybe I'll try and do a bit of preparation next time and get a bit more slick at this. But anyway, we're getting there. So yeah, checking myself out of here. If anyone's made a comment while I'm here and I haven't answered it, I apologize. Sometimes it happens, but I will pick it up next week and I'll answer you directly in the comment section. And thanks for visiting. Thanks for watching. Thank you. Like and share. You're supposed to say like and share, aren't you? That's what everyone says when I didn't feel right. Anyway, but just watching is enough. Thank you.